like now to introduce our next speaker, Anthony Brown. He's been working as a full-time Executive Director of Health Consumers New South Wales since April 2014. He's passionate about consumer and care engagement, and as a member of the steering committee of Health Consumers New South Wales, helped establish Health Consumers New South Wales in 2012. He has worked with Men's Health Information and Resource Centre at the University of Western Sydney and the Council of Aging. His vision is to make sure that health providers really listen to and show respect to health consumers, their families, and carers. You have a handout in your folder about Consumers New South Wales, so you can refer to that later. But ladies and gentlemen, welcome Anthony Brown.
Thanks so much, Jess, for that great introduction. I'd also like to acknowledge the Darug people, the traditional owners of the land, and I also pay my respects to elders past and present, and to any Aboriginal or Torres Strait Islander people who are here today. And I also pay my respects to the elders of all the various communities that are present or represented today. Because I think the traditions and the linking with elders and community leaders really holds the key to a lot of what we're doing here today. And thank you to Michael and to the team at Multicultural Health for inviting me to be here today. Michael said, "Oh, you guys are doing some really great stuff. We like your engagement model. Why don't you come and tell people about that? Tell people a bit about community engagement. Tell people what you do." And, oh, yeah, that's great. And you got 15 minutes. So here we go. I will... So Jess, please keep me to time, because one of the things I didn't put in that introduction was, having worked at a university, I do like to talk. So slow me down or if I'm going too fast. So a little bit about Health Consumers New South Wales, which is the organisation we're from. We're an NGO, and a relatively new NGO. We've only been going since about 2010. So we're a statewide independent member-based organisation, as you can see there. And what we aim to do is provide a voice for the people who use the health system, for health consumers, so that they help shape health policy and services in New South Wales. And I'd like to say that while I know a little bit about this, and I'll be talking about some of the ways we're trying to do this and what that sort of engagement looks like, I know a little bit about that, and that's what I'm talking about. I'm also here to learn, and learning about working with and engaging with people from called communities is something as an organisation I admit we need to learn about. So I'm here to learn as well. I was really interested and excited by the title, the subtitle around today's forum. Developing new and innovative approaches to engaging and communicating health messages for culturally and linguistically diverse communities. Fantastic, important. But what do we mean? And what do we particularly mean by this word, engaging? And I'd like people just to take a second to think about, in this context, but also generally, when we say engaging or engagement, what springs to mind? Are we talking about something that's appealing, something that's nice and that we want to be involved in because we like that? Yeah, that's engaging. Are we talking about creating and delivering messages or content that people will connect with? In this context, I think that's part of what we're talking about, definitely. We're talking about this. But we'd say, when I'm talking about engagement and talking about consumer and community engagement, I'm talking about activities that really involve people who use health services, so consumers or communities, in decision making around health services. So that might be in policy development, it might be in service delivery, it might be in evaluation, as well as in care and decisions around people's care. And I was interested but not surprised to see that in the policy If we look at the strategies, we'll see words like consult. It's important to consult with communities and with people from CALD backgrounds. There's a need for representation. One of the strategies talk about increasing the representation of people from CALD backgrounds on various committees and groups within New South Wales Health. And it talks about engaging with CALD communities, particularly around issues to do with chronic disease and chronic disease management. So what's quite exciting is that I think we're seeing in a range of levels from both health department, health services, the need to engage and get people involved, and also that's being reflected more and more in government policy. And as I said, specifically in this policy, which is so relevant for us here today. I want to quickly, there's a couple of other terms that I use that I want to quickly define. I apologise for the people in the room who are very familiar with these terms, and I know, where's my mate Jess? There's Jess from Sydney LHD, who could be giving this talk around consumer engagement, because Jess is one of the people who's really made a lot of inroads in this area in the state, and so I congratulate and acknowledge Jess and the other colleagues for that. So, health consumers, simply put, are people who used, have used, or are potential users of health services, including families and carers. Now, I know that sort of includes just about everybody, but when you think about it, we all have used or have the potential to use health services. And we all, as citizens, have a stake in health services, because however you look at it, we're paying for them. So that's whether that's through our taxes, whether that's through direct fees for services, or whether that's through health insurance premiums, it's us who are paying. And so we have a right and a role to play in this. So consumers can participate as individuals. They can get involved in groups or organisations that represent them. And they can do that as representatives of communities that they belong to. And I often get asked about why this particular word, why consumer? Aren't we talking about patients? Well, in some situations we are talking about patients, but the term consumer is something that's actually come out of talking to various consumer groups and consumer organisations over the past 10 and 15 years. It's a word that consumers themselves have said that we'd prefer to use. I don't know, there's contention around that, but that's still the strongest and I think the best reason to use that term. And it's preferred to patient primarily for this reason, because when someone's a patient, there's a definite power relationship that they're in that point in time when they're actually using health services, maybe being in front of a doctor or in a hospital. There's a power relationship that's not quite equal and that we need to balance out. When we use consumer, we're trying to break down some of those hierarchical relationships. And also, if we get back to the definition about people who have used or are potential users of health service, people who may have a chronic condition aren't patients all the time. We're only patients for some of the time. So that's part of the reason why we use that word. And also briefly community, and I know people in this room are very familiar with that term. So when we're using that term, of course we're referring to a group of people or organisations who have a common local or regional interest. And for us, of course, it's health, have an interest in health, so communities of health. And communities connect, as people in this room know, through issues around place, they live in a certain location, communities of interest, around specific issues, or through sharing, and this is, of course, most relevant today, culture, religion or language. So, Jess, how am I going time-wise? Good? Okay. So, what does this mean if we're talking about communication and information. Why talk about engagement? And isn't engagement just around creating messages that people connect to? Well, yes, but there's obviously so much more than that. Many people in this room will be familiar with the Australian Commission on Safety and Quality in Healthcare's standards, health and the safety and quality health standards. And for us, what's particularly relevant is Standard 2, which is about partnering with consumers. And in that standard, it talks about the spectrum or the ladder of engagement and the different levels which are needed to engage people. And the starting point really is about informing people. It's about giving people good quality information, whether that be about their health, about particular conditions, about the health service, about whatever it is we want to talk to people about. Moving through to consulting, asking people what's important, gathering the information from them, giving them feedback, partnering, or actually working a bit more closely with people, maybe helping people, having people involved perhaps on committee levels and around designing services and projects. Through to delegating, where we actually give people some authority around what's going on at that level, right through to control, which is where we have consumers or communities involved in the governance and making the big decisions about what we do. In health services, particularly within the public health services, this area can be quite a challenge, but I'm sure there's people in this room who've worked with areas where there are consumer-controlled organisations, particularly in the Aboriginal sector, but we're also seeing co-ops forming around health where people are coming together and creating health services in their communities and employing people and health professionals. So the whole dynamic of how people are engaging in health is shifting. Some of it's being driven by consumers and consumer organisations who are saying this has to happen because there's elements of our healthcare that we're not happy with. And some of it, as I said, is being driven by policy, whether that's policy like the Healthy Culturally Diverse Communities policy, or whether that's through things like the Standard 2 and the accreditation standards. Now, this is one of many spectrums or ladders of engagement and getting people involved. And people are perhaps more familiar with the International Association for Public Participation spectrum of engagement, which again starts with informing and ends with giving people some real power and real authority. I'll make these slides available to people, and I encourage people to have a look at the IAP2 website, because this slide I think actually goes through some of the areas where communication becomes important around these different elements and what we're actually talking about here. So starting with from the inform stage, where we'll actually work to provide you with information, and through to, if we move up to a consult stage, where we don't just provide you with information, we get information from you and provide you with feedback, right through to empower, where we're placing not just information but decision making in people's hands. And what I'm trying to, I suppose, introduce, and I know, as I said, some people are very familiar with these spectrums of engagement, is the idea that communication and information are really important parts of engagement, and they're part of a whole. And what are we working towards with the information we're providing to the communities we're providing that information to? One of the things we've done at Health Consumers New South Wales, and we've done this in partnership with colleagues at went west, which is the primary health network for Western Sydney, is bring together some of the evidence around engagement to create a model, to give people an idea about how do we connect with communities and with consumers so that we're giving people a real say in how our health service is run and the sort of things that we're delivering, and that we're making sure we're actually meeting the needs of our consumers in our community. So at the heart, I won't go through the whole model, but I want to go through this section and say what's at the heart of what we're trying to achieve here. All those points about engagement and the ladders of engagement, or the spectrums of engagement, or whatever we want to call them, they're important, but we don't do them for their own sake. We do them so that we can improve care. We do them so that the care we offer as clinicians and as organisations is the best that it can be, that it is truly consumer-centred care, and that we're truly part of consumer-centred organisations who exist for our communities and who exist to do the best for the people who use our services. So we suggest that if you want to find out more about how can we do what we're doing better, what's the quality, how do we improve the health, the safety and the quality of the services that we offer, we need to look at the people who are using our services, our consumers, partner with them, and make sure we've got the structures in place within the organisation to talk to them about what's going on. And we call this top-down engagement because it's about the organisation making sure that what we're doing with the people in our organisation, our consumers, the people we're already connecting to, we're doing that right. The other thing we need to do and think about is how do we make our organisations open to hear the voices of the people who may not be using us? How do we make our organisations to the people in our local community and the communities that we're meant to be servicing, how are we open to hearing their voices? And we want to do that to improve some of the things that we're not already doing. So that might be around access. If we've got poor access in certain areas, how do we make ourselves an organisation that listens to and can learn from the groups who we're not talking to? How do we find out what the health needs are of the people that we're not already connecting to? And we call that a ground-up engagement. How do we become more open to partner with the community? So the handout actually goes through some of these ideas and builds on the model. And from the core of the model, we build on other important elements, and I'm not going to go through these in detail now, about getting people involved in governance, making sure that we're a values-driven organisation where engagement's important to us, through to what are the inputs that we need to make this happen, and what are the things at the end of it that we need to look at and measure to know that it works, our critical outputs and key outcomes. And as I said, there's a flyer here in your folders with more information that I'd encourage you to have a look at. And at any time, I'm happy to give a more fulsome presentation around the model or talk to people one-on-one about what that involves and what we're doing. But as I said, we offer it as a starting point. We don't think this is written in stone. We offer it as a starting point for organisations to use and think about their engagement. There's some of our details. That website up the top will take people to find out more information about the model, including a detailed report that brings together all the evidence that we use to bring it together. There are our contact details. We're on Twitter and Facebook and LinkedIn, and once Michael's a PhD in social media, he can come and tell us all the things we need to do to make sure that we're engaging properly with the communities we need to engage with. So he's shaking his head, which I'm assuming means yes. So yes, thank you, and I'm really looking forward to being part of the discussions today.